Assalamu alaikum, the clinical day. The scenario: Mrs. Sophia Adam, 38 years, referred to you with a complaint of chest pain. Your role: you are the senior house officer, the medical clinic. Sit with her, the task: sit with her, examine her, and address her concerns.
Okay. Good morning. I'm Dr. Iman Ahmadi. I'm the doctor in charge today. I just would like to confirm that you are Mrs. Sophia Adam and that you are 38 years old. Are
Yes, I
you?
am. Yes, I am.
Yes. Welcome, Miss Sophia. It come to my knowledge that you are complaining of a chest pain. Can you speak to me more about it?
Yeah, doctor, I have this chest pain. It started all of a sudden today, and I'm not able to tolerate more, doctor, this pain. That's why I went to my GP, and he referred me to you.
So, can you tell me is this the first time that this pain happened?
Actually, doctor, I had chest pain before, but it wasn't like this. It was different in nature. This time is too much different.
So, can you speak to me about the nature of this pain? Is it dull aching? Is it some sort of burning pain? Is it stabbing pain? Can you describe the nature of the pain?
Yeah, it's like stabbing one, and
It is stabbing.
yes, stabbing one.
Yeah. Um, okay. Is it progressive? Is it progressive?
Yeah,
That means
yeah,
that
it's increasing, doctor. Yes.
yes, it is increasing. So can you tell me, is this pain, if I'm speaking about the intensity of this pain, if you can rate it or score it from 0 to 10, can you describe it or can you
It's
score it?
around seven, doctor, to eight.
7 to 8. I'm sorry to hear that. I'm sorry. So can you tell me, is this pain traveling to your back, traveling to your hands, or it is affixed to your chest, or it is in
No,
your
doctor.
chest?
Yeah, it's going to my back. Yes, it's not to shoulder. It's to the back.
It's going to your back. Okay,
Yes.
I'm sorry about that. So is this pain associated? What worsens this pain and what increased it?
When,
Um,
when yeah, when I lie down, doctor, the pain is more worse.
okay, and what relieve it?
When I sit, doctor, when I sit, I feel the pain much better than lying down.
Okay, is there any kind of awareness of your heartbeat?
No, doctor, I don't have this feeling.
Do you can wake up at night grasping for air?
No, no,
Are you lying on many pillows or you are
no,
lying
doctor.
flat? No.
Even
Okay.
I cannot lie
Um,
flat, doctor. Now I use to sit while trying to sleep, doctor, because of this pain.
Okay, can I ask you about is this pain, is it associated, are you coughing? Is it associated with some sort of
No,
coughing?
no, doctor, no cough.
There is no cough. Okay, so is there any history of leg pain or swelling in your legs in the past
No,
history or even it never happened
no,
to you?
no.
Mm, Okay. So I just would like to ask, no heartbeat. Okay. Had you any history of family of heart disease in your family, of cardiac disease or stuff like this?
My father was having a heart attack, and my mother was diagnosed with rheumatoid arthritis.
Was diagnosed with okay. Had you make your lipid investigation on your lipids before?
No, no, doctor.
What about your blood glucose and what about your blood pressure?
My blood pressure is okay, and blood sugar as well. Both are okay.
Okay. So I'd like to know um, is there any kind of soreness in your mouth?
It was, doctor, before, but recently I didn't have. But it was for, I think, happened once last year.
Um, Okay, so any soreness I'm sorry to ask you this question, but any soreness in the private area?
No, doctor, no.
Okay, so is there any rash in your skin?
Yeah, doctor, I face some rash on my face.
Can I see the rash, please?
It's red, doctor, but it's not there now.
Okay, so is this rash, it was where exactly it was on your cheek?
Yeah, doctor, exactly. It was in my checks.
Okay, does this rash increase with light, with the sun exposure, with sun exposure?
Yes. Yeah, doctor.
Okay. Is there any rash in your scalp or and loss of hair?
Loss of hair? No, I didn't face this problem before.
Okay. Any rash behind your ears or
No,
at your hairlines?
no, doctor.
Okay. Okay. I just would like to ask, is there any joint pain?
Yes, some pain in my hands, doctor.
At which joint exactly?
All hands joint, doctor. No particular joint.
Okay. Is this associated with any swelling? Any
No, no
swelling in
swelling,
the
doctor.
joints?
No,
Is there any deformity?
no deformity.
Okay. Is there any stiffness which increases in the morning?
Yeah, there is some stiffness, doctor. Yes, you're right.
For how long this stiffness remain?
It stayed for the 30 minutes early morning, then it will resolve with movement.
Okay. So I just would like to ask any change in the color of your eyes?
No,
No yellowish discoloration or reddish
no,
discoloration or anything is ended? Okay. Any changes of visual acuity or something like this?
no, doctor. I can see well.
Okay. So I'd like to ask any any rash in your lower limb in the front of your chest?
My legs? No, doctor. No rash in my legs.
Okay. Any tummy pain?
No,
No tummy pain. Okay. I just any past history. Is there any past history of lower limb swelling?
no, doctor. I didn't have leg swelling before.
Okay. Any history of loose motion? Of loose
Hmm.
motion?
No, doctor.
What about your water work? Is there any burning sensation?
No burning sensation.
Any discharge from below?
No, no,
Okay. Does your water work increase in frequency?
no.
Any fussy water work?
Yeah, doctor. I noticed some frothiness in my water work.
Any puffiness in your eyes?
No, doctor.
Any distension of your tummy?
No,
Okay. Is there? I'd like to ask. Is there any lumps or bumps?
no, doctor.
Does anyone told you that you look paler than before?
No, no.
Any fatigue?
Yes, doctor. I feel fatigue most of the day for a long time.
Okay. Is there any headache? Any abnormal movement,
No,
weakness?
no, doctor. I
Any
don't.
alteration? Any altered sensation?
No, doctor.
Okay. What about your intimate relationship? Are you in a relationship now?
Yeah, doctor. I have partner.
You had a partner. Okay. Um, had you been pregnant before?
I had and I lost, doctor.
So you had previous miscarriage. Is it frequent or it
Yes,
occur one?
it
It is frequent
happens
miscarriage.
twice. Yeah, it happened twice, doctor.
So is there any history of blood clot?
No, doctor.
No history of blood clot in your family?
No, no, no. My father heart attack only.
Okay, I'm sorry to hear that. Any tight Chinese skin?
No,
Any difficulty in swallowing?
no, doctor.
Any pain in the tips of your finger or discoloration?
No,
Okay, any muscle pain?
no, doctor.
Any difficulty while combing your hair or while getting up from a chair?
No, doctor.
So I'd like to know what are you doing for living?
I'm
What's your
accountant.
occupation?
Yeah, accountant, doctor.
So how much the symptoms can impact your job?
It's it's okay, doctor. Apart from the chest pain, which happened recently, I can tolerate, doctor.
Okay, anyone? What about your? Anybody help you at home?
Yeah, I live with my partner and I can cope, doctor, with my home.
Okay, and so what about your drug history? Can I know exactly what are you taking of drugs if you are taking medication?
Yes, only paracetamol when I have some pain, and also for the stiffness, I can use medication called Relaxon.
Tell me what is the medication name? I'm sorry, I do not hear it.
Relaxon. For the
Mm.
stiffness, I use Relaxon.
Oh, that's okay. I'm sorry for that. So I will just, can I make an examination? Can I examine
Yes,
you?
sure, doctor. Yeah,
Okay.
go ahead.
What about the blood pressure? The blood pressure?
140 over 90.
140 overnight. Okay. What about the pulse?
Pulse is 70,
So
regular.
I'm gonna examine your hands. I'm gonna examine your knee joints. Sorry, your hand joints. Okay.
Okay,
So
what? Tell me what step by step. So what you want to do? If you want to examine the
uh,
hands,
yes. First of all, I'm gonna see by inspection if there is any kind of swelling. You say there is
no
no swelling.
swelling, no
Deformity.
deformity, no deformity. What
Um,
else?
I want to see that if there is any scars.
No scars.
Okay. If there is
This
any rash,
is no
any rashing,
rash.
any
No,
muscle wasting.
no
Okay.
muscle wasting.
With the dorsum of my hand, I'm gonna see if it is warm with the dorsum
Perfect.
of my hand,
Yes,
and I'm
perfect.
gonna compare it. So can you just bare your forearm so I can just put the dorsum of
Yes,
my hand to
yes, you
compare?
can. No, no words.
It's not, yes. Excuse me, I will just will very delicately, I will touch this joint. So if there is
Mm-hmm.
any pain, just make me know. Is this
Okay.
painful?
No pain.
Okay. So I'm going to see if there is any nodules here in your elbows. Can I see if there's any elbows nodules in your elbow?
No, no, no mass or no lumps in the elbow.
Okay, so I will ask you, I will put some coins. Can you pick them? I can
Yes,
see if you can.
yes, she can do. What else?
Yes, can you button?
Yes, she can. What else?
Can you button and unbutton
Yes,
your
she can. Yeah, she can do. The function is okay, preserved.
Okay, so I'm just gonna see the power of the four of the arms. I'm gonna see the power against
Yeah,
resistance.
she can't hold your hand well.
Yes, okay. So I'm gonna examine the head. If there is any, I can see the butterfly rash. I'm gonna
Yes,
examine
no
also.
rash now. Yes, what else?
Okay, I'm gonna see the oral cavity for any mouth sore.
No source. 2 minutes
I'm
left.
gonna.
Yes, go
Okay.
ahead. Continue.
Yes, I'm gonna see the if there is any rash around the scalp.
No, no
Um,
rash.
I'm I'm gonna see the abdomen. If there is any truncal obesity.
No,
If there is
nothing.
any sign of previous usage of steroids like Strayarobra or
Perfect.
Alba and so on.
Perfect. No, nothing.
I'm going to examine the heart. I'm going to examine the chest and the heart. I'm going to
Yes.
examine the heart for
Yes,
any
perfect.
valvular for Liebman sac.
No,
Um,
no murmur.
okay. Yes, I'm going to also examine the chest, the chest. Okay.
Perfect.
Uh, And also, then I'm going to see the lower limb. In the lower limb, I'm going to see if there is any lower limb edema for any renal involvement or cardiac involvement.
Nothing.
I'm going to see
Knee
if there
edema,
is
1 minute left.
okay, I'm going to see if there is rash. So I just would like to ask you, what is your concern?
Yeah, doctor, what this chest pain? It's so agonizing me, doctor.
Okay, I'm going to tell you something. It's a medical condition which is called systemic lupus erythematosus. It is a condition in which there is dysregulation of your immune system or of your defense system, and um, it is attacking your joints, and it is even attacking the lining of your heart and the lining of your lungs, and it may be the cause of your chest pain, which we call it pericarditis, or even we can tell it pleurisy. Um, and um, and we're taking we will take some medication to relieve this pain, and we are going to do further investigations in the form of some tests and also some imaging. Had you another concern?
Okay, doctor. Yes, doctor. And what about the rash, doctor?
About the rash, it's also related to this condition. Okay, and by taking medication, the rash will disappear.
Okay. What about the future babies, doctor? Can I have babies?
Yes, actually, you can have babies, but first of all, you have to evaluate your condition, and you even you have to run further tests. You have to make some tests, and your pregnancy should be planned. So you have to make some planning
Okay,
for your
time is up.
pregnancy.
Perfect. Okay, time's up. Present your case to the examiner.
Um, this woman, she's 38 years old. Her name is Jean. Her name is, I don't remember, Simon, I don't know. And
Sophia
she's
Adam,
present.
yes. Okay, go ahead.
Okay, and she is presented with chest pain, and
Mhm.
she has also a malar flush, and she has chest pain, which I think it may be pericarditis, or it may be even pleurisy. Okay, and she also had a previous history of abortion, and it may be complicated by antiphospholipid syndrome.
Yes. Did you localize
Yes, and
the
it may be also complicated because she had also a frothy urine. It may be also complicated by lupus nephritis. So I had to run further investigation to confirm the diagnosis and the complications.
perfect? Okay. Did you localize the pain, the site of the pain?
Yes, the pain was localized. So I had this pain was localized. The localization of
So
the pain,
yeah,
which include um, is more about serositis. It's more serositis
yeah,
than being. I had two ideas I'm thinking about, or two the differential diagnosis,
yes.
that the
Tell me
patient
what
with
are.
systemic lupus
Mhm.
the patient with systemic lupus, and especially when I am thinking about or she may had antiphospholipid syndrome, they
Okay.
are very liable to have a pulmonary embolism. So I thought about it. But pulmonary embolism, there'll be hemoptysis, okay, and they also be lower limb swelling or DVT, history of previous DVT, lower limb swelling and stuff like this, but the patient ignore having previous conditions like this. Number two, I had also thought about any kind of, I had excluded any kind of coronary
Mm.
artery disease
Perfect.
because it is
Yes.
not referred to the hand, and the history of the cardiac disease was completely normal. So it had been excluded. I had also tried to exclude Behçet syndrome or Behçet disease, but she had no lower limb, she had no genital sores. Plus, it's still put in the differential diagnosis. But it is more going with the stigmata of systemic lupus erythematosus. So
Oh,
like this.
okay. So your differential, give me your differential in order,
My first differential
including
diagnosis,
the
it is,
diagnosis. Mm.
yes, it is systemic lupus
Yes.
erythematosus, which is complicated by serositis.
Okay.
Um, and it may be, I don't know, antiphospholipid syndrome may be associated. I had to run further investigations. The second
Perfect.
one, is Behçet still, because there is history of a mouth soreness, and there is also, but joint pain. Okay, it's going with Behçet. Number three,
Okay.
I had also excluded the other causes of psoriatic arthritis, arthropathy, because there is no rash. I had also excluded
Okay.
enteropathic arthropathy and reactive arthropathy. All of them had been excluded.
Okay. You
And I
mentioned
had,
PE. You mentioned
yes,
PE as a differential. Did you ask about the travel history?
No, actually, I don't ask about the travel history. I just ask
Okay.
about the
No,
symptoms.
no worry. No,
Yes.
no problem. No worry.
Yeah.
How you can investigate this patient? Tell me what's your investigation steps?
First of all, I had to confirm the diagnosis of systemic lupus erythematosus. It will be number one by doing the routine examination. The routine number one, the routine investigation. If I'm doing a CBC, I can find hematological complications like anemia, sometimes
Okay, tell me
pancytopenia.
specific investigation. A
The
specific
specific
investigation.
investigation, there are many serological investigation. I will do double-stranded DNA. I will do anti-Smith antibody, anti-double-stranded antibody, and anti-Smith antibody and ANA, I will also do a C3 and C4, but it's more for monitoring of the disease. The ESR will be elevated. The CRP will be normal. The CBC will indicate if it is complicated by hematological complications like anemia, thrombocytopenia, pancytopenia, and sometimes leukopenia.
Okay, if
I'll
CRP
do
is rising,
investigation for the
if CRP is rising, what you suspect?
if CRP is rising, it may be complicated by further infection or inflammation, or
Yes,
it may be
yes,
inactivity.
yes. As you said, it's infection. CRP in systemic lupus is always normal or low. Okay. How to manage this patient? I will add 1 minute for evaluation. How to manage this patient? Tell me.
And number one, I had to treat. You are speaking about the treatment. First of all, I will treat the attack. We are treating it with a steroid. We can give immunosuppressives, which is like cyclophosphamide, and sometimes we give mycophenolate. And as a further treatment, we may give immunosuppressive biological treatment like rituximab. That's during the attack. In between the attack, we can give to the patient hydroxyquinolone. Yes, I guess it's
Chloroquine, doxychloroquine.
yes, hydroxychloroquine. Hydroxychloroquine, especially, it will improve the skin and it will also improve the joint problems. And we can also give azathioprine, and we can also give immunosuppressive if the patient is not.
This is for SLE. What about pericarditis? How you treat the pericarditis?
Indomethacin, I guess. Yes, we gave analgesics. I guess it was indomethacin, aspirin. I don't remember. It was analgesics, a type of analgesics, but I don't remember the best one was what, actually.
Okay.
The pericarditis.
Okay.
Colchicine?
What is the
Colchicine, I guess.
yes? Okay. Tell me what the finding in ECG you could expect in this patient.
Oh, I do forget. It was prolongation of the PR interval. I guess something like this, or depression of the PR.
PR depression. Perfect. Yeah. This is the
Yes.
specific.
Yes.
Yeah, okay.
I had to take a snip. Because the patient has a fast urine, I had to make ultrasound. I had to take a snip to evaluate
Okay.
the progress of the patient's
Fair
renal
enough.
function.
Fair enough,
Thank
Dr.
you.
Iman. Well done. Thank you. Well
Thank
done,
you.
Dr. Iman. Yes,
Thank you.
you did great as first time practice, and you reached the diagnosis along with the differential and also the investigation approach, the management. Actually, all what you did are great and perfect. If I can add some comments, it will just for perfection only. So
Thank you.
starting by the clinical communication, yes, the history taken was okay, system review was okay, but I give you a history of chest pain now and before, and you didn't analyze the previous chest pain. I told you I had chest pain before, which was different in the character. You ask about the current one. What you suspect about the other one? Patient had chest pain before, and you said it in the differential.
It may be PE. It may be pulmonary embolism.
Do you think the pulmonary
It may be
embolism will be
pleurisy.
uh, uneventful? Yeah, pleurisy, yes. So the pleurisy on and off as serositis syndrome, okay, or as as serositis association.
Yeah.
Okay, so this is for the previous. Whenever patient or surrogate tell you history of something positive, you have to analyze it. You analyze the current one. But again,
Okay.
you didn't. I think you ask for the radiation, but localizing the chest pain, where exactly in the middle, in the periphery, you have to know. Sometimes they can bring for you
Yes.
myositis or costochondritis, and for by localizing the pain, you will know what the differential. It was recently
Yes.
in last diet, uh, MI or costochondritis. So you have
Yes.
to know the atypical chest pain. If I ask you
Yes.
this is typical or atypical chest pain, what you can say about this chest pain?
Which is the pleurisy or the costochondritis? Are you asking?
Pericarditis. Pericarditis.
Um, I don't know, but I guess it's typical.
So what's the definition of typical chest pain and what the clue of chest pain or typical chest pain?
Uh, no, it's not a typical chest pain. I guess a typical
Yes,
chest pain, it is the one
atypical,
which we
yeah.
do in order to diagnose acute myocardial infarction. Okay,
Perfect.
in
And
which
what the
it
nature
is
of
referred to
typical
the
chest
valve.
pain?
Okay, yeah.
The typical chest pain. Tell me the nature of the typical chest pain. Because it
Um,
comes and you can put it as a first differential and you have to roll it out by the history.
yes, yes. Number one, it's characterized by being it is throbbing in nature. It is referred to the back or referred to the hand, to the arms.
Shoulders. Yes.
Yes,
Shoulder
to the
or jaw. Yeah, shoulder or jaw.
yes.
And the nature, what you said,
Shoulder.
the nature is
It was it was I don't remember how it was.
heaviness. Heaviness.
Yes, heaviness. Yes,
Yeah,
okay.
so the
It's
patient will feel
heaviness.
something heavy on his chest, right? This is the typical chest pain in
Yes,
cardiology
yes,
point of view. So you have to roll out this. And I think you rolled out by asking most of the question. But still, you have to
yes. But I
suspect.
had to read out by ECG. Yes, by ECG and troponin. I guess I had to do this
Yes, okay.
and cardiac enzymes.
Yes, of course, you have to put it in the plan and the investigation. Okay, this is for the chest pain as a history taking. The other thing, I think you cover all association of SLE. I mean, mixed connective tissue disease. You ask about Sjögren, you ask about systemic sclerosis, you asked about polymyositis and myositis, dermatomyositis. You ask about the rash, antiphospholipid. You cover all the autoimmune association or connective tissue disease association with SLE. This is good point, okay? And you have to do it in any patient present with SLE or associated joint or whatever. Rheumatoid arthritis as well. You ask about the stiffness and the joint. So this is perfect in taking history, okay? Regarding other system, you covered well, but you missed the travel history and the social, and it's very important. You put that PE in the differential. It's not enough to mention the DVT or swelling of the leg or the size of the
Yes,
leg to say this is DVT and complicate by PE. You have to ask about the provoking factor, which is travel. For example, in this in the history. So
yes,
it's important to ask about that. You ask about the family, any medical condition before blood pressure, but blood sugar,
yes,
and also perfect question about the female history, pregnancy, period, and pills. You have to ask about pills. You didn't ask about the pills.
yes,
Should be
yes,
asked here. But you explore the miscarriage, which is related to antiphospholipid syndrome, and you have to put it in the diagnosis along with the investigation. You have to mention the investigation for APLA, antiphospholipid syndrome. Okay,
yes.
antibody
I just
syndrome.
would like to ask the
Yes,
OCD is important here for in antiphospholipid.
yes, it's a trigger for clotting, right?
Ah, okay, yes,
And yeah, you have to, if she is taking, you have to give her some advice related to it. Okay.
okay. So, what will be the advice? She had to change she had to change it to another.
Yes. What's the better advice? What do you think? To
She had to
change
take
or to
intrauterine
refer?
loop.
To change or to
Intrauterine loop.
refer?
To change it. No, I prefer to refer her.
Yeah, better to refer.
Yes,
Whenever the question is not for you, refer her better. If he asks you as a
Yes.
knowledge wise, you can say yes, she can use mechanical. But the best thing is to refer the patient to the woman doctor to
Yes.
have a planned and safe pregnancy, as you said. Okay.
Okay.
This is for the history that also the occupational, you ask the smoking, alcohol, the job, the impact. Since no eye affection here, no need to ask about driving. Then
No, I had to ask about driving.
no, no, no vision affection, so no need to ask.
Yes, 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 you're right.
Okay. Then
Yes,
the concern. Sorry, let's go to the examination. I think you examine the old system, but you have to start before the face and the face and the eye and so on. You can start by the complaint with this chest pain.
yes, you're
Okay.
right.
I mean, after the hand, you just examine the hand very well. Look, feel, move. Look, feel, move. You did everything in the
Yes,
examination. Even the function,
yes,
you did it twice. The buttoning, and one is enough. You can do either pick up the coin or buttoning and buttoning.
yes.
Reverse and prayer sign, prayer and reverse prayer. You can do it also as a function. However, it's not. It will not be affected because this is what do you call this affection of the joint in the hand?
It
What's
is
called?
a correctable, a correctable.
Yeah. So it's called the name of the
Charcot deformity.
Jacot, yes, Jacot
Mhm.
arthropathy, yes.
Yes, Charcot
So
arthropathy.
it's not deformity, or
Yes,
it's correctable if it has. Okay.
yes,
Then examination of the heart. I think you will not find. Maybe you can hear pericardial rub in the examination as a pericarditis, but apart from this, no signs of heart failure. And the face, yes, you have to examine the mouth, the eyes for the soreness, also for the rash, and the kidneys you can offer. And last, the legs. If you suspect PE, you have to offer measuring of the
yes,
circumference
yes,
using a tape. Okay.
yes, yes,
Yeah. So if I can give you scale for the mark physical examination, you did great. I think it's satisfactory. Finding also identify finding, you did everything. Proximal myopathy also, I forget to mention, you did it. Proximal myopathy. You did proximal myopathy examination?
yes. I ask the patient to move his hand against the arms
Yes.
against resistance.
Yes. Okay. So physical examination will be satisfactory. The also the identify finding satisfactory because you picked most finding. And for the clinical judgment, yes, you give me the whole plan. By the way, the management of pericarditis is methylprednisolone related to
Okay.
SLE only. But if
Yes.
pericarditis other than this SLE, you can use colchicine, yes, as you said, or high dose
Mm,
aspirin. Okay, this is for the
okay.
clinical judgment. Differential diagnosis also, you put the PE as a most serious one. You put ischemic heart disease as a possibility due to antiphospholipid syndrome. And pericarditis, the case was here. You did it. So the differentials will be satisfactory. The concern and welfare also was satisfactory. You did it perfect, Dr. Iman. Thank you. Yeah, you
Thank
have
you.
any question?
No, thank you.
Okay, so we can hear the comments from others or questions. Anyone has comment or question, please, he can comment. Any missing points? Sometimes I miss some of points, so it's okay. You can add or you can suggest anyone, or I will choose by name, Dr. Azhar. Any comment? Dr. Ahmed, Muhanna.
Assalamu alaikum.
Wa alaikum assalam, Dr. Azhar. Yes, please.
MashaAllah, Dr.
As your
Raiman,
touch.
she did very well.
Yeah.
Almost she covered almost each and everything. Was only she, as you mentioned, she forgot to take history of travel.
Mhm.
Almost she did very well, mashallah.
Okay, thank you, Dr. Azhar.
Welcome.
Any
Thank you,
added
Dr. Ahmad.
suggestion? Any added suggestion? Any point to be raised here? Feel free to comment, please.
Thank you very much, Doctor. But I think he did very well. About neurological history she took. I missed that maybe. Some
She asked
question
about
related to
weakness.
neurology.
Yeah. She asked
Doctor.
about weakness and sensation, change of sensation. Yes, and
Very
vision
good.
as well.
And
Very
seizures.
nice.
I also asked about seizures and psychosis.
Yeah, but Dr. Iman, you missed the mood, please. Always, whenever
Yes,
you
I
have.
missed it.
Yes, good.
Yes.
Thank you, Dr. Muhammad. Yeah. The mood and the sleep. Remember
Yes.
SMS always. SMS. Sleep, stress, and mood. Sleep,
O-
stress, and mood.
Okay.
SMS. Okay. Thank you, Dr. Muhammad, for this point. It's very important in SLE patient. Most of SLE patients might have depression.
Okay.
And also she asked about the shakiness as cerebritis. It's important
Yes.
to
Yes.
ask about. Yes.
Dr. Iman, you asked about smoking and alcohol because I did not hear.
Yes. No. Actually I forget smoking
Yes,
because I
Really?
jumped to the
smoking.
examination. I jumped to the
Okay.
examination immediately.
Mhm.
So it will be missing now, borderline in the clinical communication. I thought she asked about, but thank you,
No,
Dr.
no.
Azhar. Yeah, yeah. Oh, well done. Yeah, but she asked about the job. Yeah, yeah. She jumped to the job.
Yeah,
Yes.
job. Yes, yes. He asked about the job.
Yeah, you have to ask Dr.
Yes.
Iman. Do you
Yes.
smoke? This is my approach. Do you smoke? Do you drink alcohol? Do you drive? What's your job? All these
Yes.
questions are packaged together. Ask them together
Yes.
to pick up any of these finds. Not to miss the
Yes.
driving, because whenever you ask for do you smoke, do you drink alcohol, do you drive, especially if the patient having a vision problem or something affecting her driving or his driving. So make it as a one question or one package of question. Do you smoke? Do you
Yes.
drink alcohol? Do you drive? And what's your job? And of course, what the
Yes.
impact of these symptoms on your job.
Yes. You're right.
Okay. Any question
Dr. Iman,
else? Yes, go ahead.
I want to ask you, what will be the names of three antibiotics in the antiphospholipid syndrome?
Yeah, perfect, Dr. Azhar.
Antibodies, the antibodies, anticardiolipin. You mean this anticardiolipin
Yes.
antibody, beta
Mm-hmm.
two, beta two glycoprotein, and
Mm-hmm.
lupus anticoagulant.
Perfect.
Very, very.
Yeah, perfect. Any question else? Any comment, please feel free.
Hi. She did very well, mashallah, Dr. Iman.
Dr. Ayan,
Uh,
welcome back. Long time.
thank you.
Thank
Thank you, Dr. Basim. I think try your best not to forget the patient name because this
Yeah.
will be an issue. And I think she used a little bit of jargon, maybe lower limbs and something else.
I corrected
forgot.
here on the time. That's
Yes.
Yeah,
legs.
you corrected
Always
on the
say
time.
legs, yes.
Yeah,
But
make it simpler.
yeah, go ahead. What else?
I forgot what was it, but there was some few jargon. I
Yes.
forgot what
Okay.
was but you corrected on the spot. Yes, you are right.
Mm-hmm.
Yes. I'm gonna take care the next time, inshallah.
Yes,
Yeah,
and the
but you
name,
did
Dr.
great.
Yeah, sorry for interrupting you, Dr. Ryan. The point of name, yes, it's important. It will be like irritating the examiner. He might not
Okay.
minus you, but he might put it as a point against you. You forget the patient
Yes.
name. So what's the solution for that? Do you know? Dr. Ryan can also give you a suggestion.
The idea that because I was responding to you very fast, if I want to remember the patient name, I had to open the chat. So I guess that in the exam, I
Okay,
have the paper in front of me.
yeah,
I
if
will
you
write his
forget,
name on the paper.
okay, this is one solution. What else?
You can
You are
say,
standing away from the patient. You cannot see the paper. What can you say to the patient or the patient? How you can tell to the examiner,
we
Dr.
can say,
Ryan?
Madam or Sir, I
Yeah,
examined
madam,
this, madam,
or this lady.
this lady.
Yeah, I examined this young lady. If you forget the name, of
Okay.
course. Yes.
Yes, okay, I'm gonna do this.
Yeah. Or madam, as Dr. Azhar said, yes, it's also one accepted word.
But I
But
think try
don't.
your best
Yes,
not to
of
forget.
course. Yeah, of course. But
Yes,
with
you
the
are right.
stress, Dr. Ryan, with the stress, you can forget your name,
So,
not the patient
so
name.
you're
Yes.
you're right. Your name forget, Dr. Basim, but the patient name no.
Yeah. Yeah. Yes, you're right. It's okay
Yeah.
to forget your name, but not
I
forget
think
patient
I
name.
think
Yeah.
it's good to use these practice sessions as the exam exactly. يعني use a white
Yeah.
paper and write
Yes.
exactly your thoughts, your differentials, and the
Yes.
things that you might forget at the end of your differentials. Write the smoking, alcohol, driving, whatever like is
Perfect.
important
Yes.
because this will be forgotten most of the time and you can rush them at the end. So if you have them in your paper, you will just go through them quickly and you will not miss them.
Yes, you're
Yes,
right.
you're right. Thank
And
you.
I think you should use the name of the patient a couple of times during your history taking to the patient to address him by his name, then or her name. That will be helpful. Actually.
Yes, you're right. Thank you.
Okay, let's read a comment. Dr. Samia said multidisciplinary team. You never mention the multidisciplinary. You give all the management by yourself. So it's yes, I guess you have to mention multidisciplinary team. Systemic lupus
Yes.
is not one system or single system affection. It's multi-system. So you have to
Yes.
invite all teams concerned to
Yes.
every system. Nephrologist.
Yes, you're right.
Here you will call the cardiologist, rheumatologist, of course, on the top of them, and ophthalmology of any if any problem in the vision. Of
Yes.
course, social work, physiotherapy, specialized nurse. Okay, you have to put all this team together with the patient. Did she ask about smoking alcohol? Yes, we mentioned already. Also relieved by rest. Yes. For the welfare of our painkiller. Yes, thank you so much, Dr. Samia.
Okay.
Too much concentrating. Whenever you have pain scale 5 and above, offer painkiller on immediately, instantly. Are you in pain now? Yes, doctor, I have pain. Can I offer you the painkiller? Here you are. Okay, it's a matter of show, just to show the examiner that you are
Mm.
caring about everything. So it might affect your welfare if you didn't give her with painkiller. Patient is in pain now. You have to mention
Even if I didn't know the scientific name of the painkiller given in this specific situation.
no, any painkiller and mostly paracetamol to be safe.
Yes.
Paracetamol the
Okay.
most safe medication.
Okay.
Okay, pericarditis due to SLE treatment by steroid. Yes, I mentioned it. Yes, it's not colchicine. The other cause of pericarditis can be treated by colchicine and other medications. Sorry, there's some noise background. Thank you. Can you post your case, Dr. Iman, in the
Okay.
chat box? And
Okay.
it is very big mistake to forget the patient name. Yes, it's big mistake. Management during pregnancy important. Yes, I told you, you have also with the team involved, you have to involve the gynecology in
Okay.
case she is having multiple miscarriage. And to have a safe pregnancy, you have to mention the gynae and obstetric team. Okay.
Okay.
But you will
Yes.
tell her woman doctor, not for the examiner, you can say gynae. For the patient, you can say woman doctor. She
Okay.
jumped to the examination before finishing the history. Is it okay? You can do whatever you want in the exam in order not to miss anything, but better to be systematic. But for example, if the time you feel the time is already run and it's about to finish and you didn't do examination and you talk long for the history, jump to the examination. You have two skills you will be judged on in the examination: physical examination and clinical identify finding.
Yes.
So in case you talk long taking history and you didn't do examination at all and you feel the time near to be finished, run the examination and tell her I will ask you some question while doing examination. It's okay. They accept anything better than missing the examination. Missing the examination, you will lose around 8 marks. Okay. But the clinical communication, only 4 marks. The differential will be along with the welfare and the concern and the clinical judgment. This is with the examiner. Okay, so 8 marks only with the examination. The history, 4 marks. So this is my advice. If you feel the time is almost finished or near to be, please do the examination and ask the question while doing examination, especially the social. You can ask the social while doing examination, smoking, alcohol,
Yes.
and you can give the advice immediately. Okay, this is my advice regarding the examination.
Dr.
Okay, Dr.
Basu,
Iman. Yes, Dr. Azhar, go ahead.
in the history you told that my pain is radiating to the back.
Mm-hmm.
But what was significance of this? Is it a sinusitis or aortic dissection?
No, no, the pericarditis.
Uh, it can radiate to the back.
Yes. Why you think about aortic dissection?
Yeah, because if the patient says chest pain is it is radiating to the back, most probably it is going towards aortic dissection.
It's I think no risk in the systemic lupus to have aortic dissection, right?
There's no risk. There's no risk.
No risk here, yes, unless the
Uh,
patient is hypertensive due to lupus
yes,
nephritis. But the
yes, yes.
pericarditis and the nature, yeah, pain, stabbing pain, and radiating the back and improving with sitting forward.
Are you sure it is radiating to the back? Are you sure? Because
Okay,
I
let
never
me
read.
confirm it. Yes, wait. Yes, there may be one both shoulder leaning forward in the case.
This pain increases by leaning forward, inspiration, coughing, and sneezing. Pericarditis.
Yes. Yes.
LICS, licks. LICS, licks. Leaning forward, inspiration, I. Then C, coughing, S, sneezing. It's written in Oxford Book of GP. Leaning forward, inspiration.
Actually, they didn't try it if it is radiating
So it's
to,
not.
the
Don't
back.
say. Don't say it's radiant because I was thinking that it
Yeah,
is also complicated with aortic dissection.
yes, yes, you're right. Okay.
So this pain may increase with bending, lying, inspiration, coughing, and sneezing. Four things this pain can increase.
But no, no, but the bending forward relieve the pain.
No, no, I'm saying lying,
Okay, lying. Okay, yes. It works with
lying,
lying and yes, improve or
inspiration,
subside with this. Yes, yes.
inspiration, coughing, and sneezing. It will increase the pain.
Yes,
Yes.
yes. Inspiration as well. Yes. The same as
Yeah, yeah,
pleurisy. Yes, you're right.
yeah, yeah, yes, yes.
Yes, thank you, Dr. Azhar.
Welcome.
Yes, pericarditis like the pleurisy pain. Yes, exactly.
Yes, yeah, it's a pleurisy like pain.
Okay, thank you. Thank you, Dr. Hatem and Dr. Azhar. Dr. Iman, the case, did you send to the chat box?
Yeah, I put
The
it on
group?
the group of I put it on the group.
Okay, okay.
Dr. Iman, I just want to add one more thing. Don't forget the non-pharmacological management in this case. Avoidance of the trigger, I mean sun exposure, what is it? Sunblock and smoking cessation.
Okay. Thank you.
And to educate the patients, it's not
Yes,
only for
education and
triggers.
counseling. Yes.
Yes,
Yes.
patient came for first time with this presentation. You have to give her some information about the disease. So you can mention, even you can waste some times talking about these things before starting doing pharmacological management or mentioning the pharmacological management. You can tell the examiner, I will educate the patient about the disease, the triggers, and the complication association, because this patient might go and come back with another complication or association, like, for example, Jogren or whatever. That's why you have to screen all, either by history and also by investigation. We don't talk about the investigation, but
Yes.
the specific, you mentioned them already. It's anti-double strain, anti-Smith, C3, C4, as you said, and anti-phospholipid syndrome antibodies. Okay. So the next
So
scenario.
I just would like,
Yes, go
I
ahead.
just would like to ask. Would like to ask a question about people who had prepared themselves before. The best time to finish the history in order to be ready to make the examination without being in a hurry. I had to finish the history taken after 10 minutes,
Okay, okay. I will give you the advice, and you will realize that no stopwatch in the exam. So whenever you
really?
feel like you up,
Yes.
yes, no stopwatch. No one will tell you anything about the time apart from 2 minutes left. And they are saying don't look at your watch if you are wearing the watch. It's not good. So what you will do, you will follow your sense. How? You
Mhm.
will finish the history as much or as fast as possible. Then
Yes.
move to the examination. And during doing the examination, you can ask the social or the occupation. This is the best
Okay.
advice. And no one will tell you 8 minutes left or 8 minutes goes or 3 minutes. They will not say anything apart from 2 minutes left. Okay?
Yes. So if I didn't cover all the systems which is not involved in the disease,
Mhm.
and I jump to the social and the alcohol and so on, this is not a problem, isn't it right? I can
No,
jump
no.
the
It's
question which will
some,
not be relevant.
yeah, some examiner commenting like is unsystematic and they will minus you in the clinical communication. So the best thing to do, start by the complaint analysis, onset, course, duration, increase, decrease, improve, relation, radiation, whatever you want to ask.
Yes.
Then you can go to the past medical history. This is my preference and what this is what I
Yes.
recommend. Go to the past medical history. Sometimes the past medical history will be clue for you. Diabetic, hypertension, and next you can ask about the surgical and medication history, allergy, any medication, and next system review. After you finish the system review, you can go to examine the patient. While examining the patient, you can ask about the family history. You can ask about the social history. Okay, and the
Okay.
travel, family
That's a
travel,
good plan.
family travel. Any HIV history. If you suspect HIV, of course, you can ask about HIV questions like sharing needles or tattooing, piercing, blood transfusion. If you suspect hepatitis, and social, do you smoke, do you drink alcohol, do you drive, and what's your job? These things you can ask while examining the patient, but try
Yes.
to run through the examination after finishing the system review. You will,
Yes.
yeah, you will save your time. But if you ask these questions while sitting, when you go to the patient, it will be only 2 minutes left for the concern. And once you hear 2 minutes left, ask the concern, because the concern also
Yes. You're
had
right.
4 marks. Okay?
Yes. You're right. It's a good plan. Thank you.
Yes. Thank you. Okay, let's start the case. Mr. Jones, 36 years, present with pain in his knee, joint, and vision problem. Okay, we can start now.
Yes.
Okay, hello there. I am Dr. Mukhtar, the doctor in the clinic today. You must be Mr. Jones.
Yes. I'm Mr. Jones.
You are 36 years old.
Yes.
Okay, Mr. Jones, we are here to take history from you and to examine you and address all your concern at the end. Is that okay for you?
Yes. It is okay.
Tell me, Mr. Jones, about your complaint, please.
My complaint started when that I had a pain in my knee joint. And this pain is sometimes hard to. I cannot withstand this pain. It's really making me. I cannot move and doing my daily work. I feel very annoyed. And after this, my vision began to be changed. I feel that I cannot work as I do every day. My daily routine is affected. I'm very sad because of all this.
I'm so sorry to hear about that, Mr. Jones, and be sure that we are here to help you and support you with this. Okay, Mr. John,
Yes, thank you.
can you tell me, is it the first time ever?
No, it is not the first time. It happened to me before, and it comes and go. But this time, I'm really affected because of my vision. Also is affected.
Okay. And did you tell you about any diagnosis before?
I know I took a lot of medication, but I did not. They didn't reach a certain diagnosis.
Okay. Mr. Jones, you told me about the knee joint. In which knee exactly?
The right knee.
Only the right. And the previous time also was in the right knee?
No, on the previous time, it was my left knee.
Okay. And do you think the movement improve or worse the pain in the knees?
The movement, it improves the pain.
Improve the pain. Okay. And did you try a painkiller?
Yes, I'm trying to take painkiller. Yes, I take only paracetamol.
Did it help?
Sometimes, but it return. When I stop the paracetamol, it return. The pain return.
Okay.
It
And
just it just
yes.
control it. But I'm not gonna take analgesics all my life.
Okay. I appreciate that. Okay. You feel any redness or warm there?
Sometimes, yes.
Okay. And the pain is going anywhere else, up or down?
No,
Any other joint pain?
no,
Any trauma to your knees?
no. There is no trauma to my knees.
Okay. To your back to your vision. Did you notice redness in your eyes?
Yes, I notice redness. Yes.
Any dryness in your eyes?
No,
Any trauma to your eyes?
no. There is no trauma to my eyes.
Okay. You said vision affection. Can you specify what happened exactly?
I had this redness on my eyes, and it's painful, but but it's some sort of dull aching pain. But the problem that I began to the vision is not clear.
So it's blurry vision only. Any double vision?
No, there is no double vision.
Any timing of the symptoms, like night or morning, or it's not related?
No, it's not related.
Okay. Any dropping of your eyelids?
No.
Mr. John, you notice any skin rash over your body?
Yes, before there were some skin rash on my legs, but it's not now.
Is it in the legs or in the back area of your feet? Down
No, it
first?
was on my legs, in the front of my shin.
Yeah. Can you describe it for me? Is it red,
Yes, it was elevated. It was elevated and painful.
painful? Okay. Is it oozing or bleeding?
No, no, it was not oozing or bleeding.
Is it there now?
Yes, no, I have no rash.
You don't have rash now. Okay. Mr. John, I can ask you some question. It might be irrelevant,
Yes,
but it will help me. You have any past medical condition I should be aware of?
yes. Once or two times before, my legs had been swollen, and it was very painful to me, especially after I traveled a very long time.
You notice you have clot, you mean?
Yes, I have a history. Doctors told me that I had history of clots.
Okay. And any other clot in your body apart from legs?
No, now I don't have, but before I had, yes.
And did you take any medication for it?
Yes, I'm on. They give me drug thinning medication.
Show me your medication list, please.
I had a um, drug thinning medication, and that's all that I remember.
Okay. You are compliant to medication?
Yes, I'm compliant, but because I'm taking it for a long time, sometimes I forget to take it actually.
Any bleeding from any area of your body?
No,
Okay, Mr. Jones. Why you are not taking the medication? You are forgetting?
Because I had to take it for a long time, and sometimes I feel bored of taking medication.
And which when exactly this happened? The clot? Since how long?
The clot happened when I go to Australia once in 1 year before, and the doctors told me that yes, and doctor told me that I had to take my medication all the time. I'm trying to be compliant as much as I can.
Okay, what other medication you have?
I'm just taking this.
Okay, any surgery before?
And no, I didn't do any kind of surgery.
Any allergy?
No, I had no allergy.
Okay, I will ask you some question now. You have any headache?
No, I don't have headache now.
Any unsteadiness?
No.
Any muscle sores?
Any what?
Mouth sores, mouth sores.
Yes, I had mouth sores. Those years I had mouth sores, but now I don't have mouth sores.
Is it painful?
Yes, it's very painful.
Oh, I'm so sorry for that. And uh, how about the any sores in your private area? Sorry for this question.
Yes, it happened to me. Yes, it happened to me. Yeah. Yes.
Okay, okay. Apart from this, you have any difficult swallowing?
No, I have no difficult swallowing.
Rash in your face to the sun?
No, I had no.
Any chest pain?
It happened to me before. Once I had chest pain, but the doctors had made an investigation and they had treated me with blood thinning. They had treated me, yes, but I don't remember actually the drugs. And I was
Okay.
admitted to hospital.
Okay. And is it a heart attack? Was it a heart attack?
No, it was chest pain.
Chest pain. Okay. Any awareness of your heartbeat?
No.
Any tummy pain?
Sometimes, yes, it happens. Sometimes I have severe tummy pain.
Can you describe for me this pain?
It is it comes and go, and it's like
Where exactly this pain?
in my abdomen.
An old tummy. Okay. You have any change of your bowel habit?
No, I have no change in my body.
Water work change?
No.
Okay. And now I will examine you, and while examining you, I will ask you some question. I will start by the
Yes.
general look and the vital chart. How is it?
My blood pressure is okay. Well, vital is okay.
Okay. Any high body temperature or any rising temperature?
No.
Okay. Now I will examine the knee.
Yes.
Any redness, hotness?
No.
Okay. Any loss of weight,
It is
Mr. Jones?
no. There is no loss of weight.
Any change of your appetite?
No.
Any lumps or bumps in your body?
No.
Okay. I will look at the knee. Any deformity? Any swelling?
No.
Okay. I will feel over it. Any warm or hotness?
No. It's not warm or hot.
Okay. I will ask for passive movement and active movement. And if you feel pain, let me know. Is it painful?
Yes, it is
Oh,
tender. Yeah, it's painful. Yes.
yeah,
Yes.
okay.
It's painful.
Any limitation of the movement?
Yes, certainly. Yes.
Okay. While I'm down, I will examine for the rash. Any rash?
No. Now there is no rash.
There is no rash. Okay. I will now examine the eye. Any redness?
Yes.
Okay. If I give you pain scale from 0 to 10 about the pain in your knee and the eyes, how much you can give your this pain?
In my knee, I give 5, but in my eyes, I give 6.
Okay. You don't need any painkiller now.
Yes.
Okay. I will offer
Yes,
you
I need.
painkiller. Okay. Now I'll examine for the visual acuity.
Decreased
Decrease in both eyes.
in one eye.
The right or the red? The left.
The left.
Any field affection to the left?
No.
Okay. Now I will offer fundoscopy.
Yes, it's normal.
Normal. Do you smoke, Mr.
Yes.
Jones? How many? For how long?
I take 2 cigarettes per day for 5 years.
And do you drink alcohol?
Yes, occasionally.
Okay. So smoking and alcohol are harmful for your condition. Please, if you don't mind, you can stop them.
That's
And
okay.
if you are drinking alcohol excessively, please also you can moderate your intake. Is that okay?
Okay.
Do
Yes.
you drive?
Yes, I'm driving.
And please, also for your safety, I can strongly recommend to stop driving until reach to the diagnosis. Is that okay?
That's okay.
What's your job?
I'm working as a teacher.
And how the impact on your job?
When I stand, I cannot stand a long time in the school, and I take some leaves recently. So it's really annoying me,
Okay, we can
and I
help
can
you on
even
this.
thank you.
Thank you. Any family history of same condition?
Yes.
Yeah, can you tell me, please?
It was my mother. She has some clotting disorders, stuff like
Oh,
this.
okay. And do you know the name of the disease?
No, I don't know the name because I didn't live with my mom. I traveled since I was 16 years old.
Okay.
2 minutes left. Well, 13. Yeah, 13.
Yeah. Okay. And last question. How's your period, Mrs. Sorry, Mr. John, right? You're okay. Sorry for this question. Last question, please. Do you share needles?
No, I don't share needles, ma'am.
Okay. And need history of tattooing or piercing?
No,
Okay, Mr. Jones, can you tell me what's your concern?
I'd like to know what I had, doctor.
Okay, Mr. John, but after taking history from you and after examining you, I think you might have a condition called Behcet syndrome. Don't bother about the name. It's a condition in which your defense system attacking your body instead of attacking the bugs. We will run some blood tests and scans to confirm diagnosis and roll out others. Is that okay for you?
That's okay, doctor. And what about my job? I don't want to have a holiday. I want to go to school and to see my student. They had an exam. I want to help them.
Yeah, I appreciate your concern and your worry. We can give you sick leave until controlling your symptoms. We have to give you some medicines to control your pain and your eye as well. It's the
Yes.
condition in which there is activity sometimes of the disease. For that, you have to take some medicine called steroid. How does that sound
Okay.
for you? You have any other concern?
That's that's okay, doctor. Thank you. I just would like this. And what about my vision?
Yes, we will refer you to the eye doctor. They will see what's ongoing with you, and we will update
Yes.
you in the next meeting.
Okay. Thank you, doctor. Thank you.
Okay, time's up. Yes, now you can start the
Yes.
examiner questions. Okay.
Yes. Okay. هو مين اللي هيسأل؟ أنا برضو.
Yes, you're the examiner now.
Okay. What is a positive finding in your case?
Yes, patient has right knee pain and
Yes.
right eye also pain and vision affection.
Yes.
So it's in the knee. I mean, it's inflammatory pain, and it might be
Yes.
related to the Behcet activity or flare up of
Yes.
the Behcet disease. And the eye also,
Yes.
I can think about uveitis because of the redness and vision affection.
Okay. Yes, that's right.
Uh,
So that's right.
Putting this together, it's I can say this is along with the history of genital ulcers and mouth ulcers, and history of blood clot, history of erythema nodosum.
Yes, that's right.
Yeah, so I can suggest this patient is having Behçet disease with on
Yes.
and off flare up.
Yes. So how you diagnose Behçet disease, Dr. Bassem?
Yes, by clinical history, I can find in the history mouth sores and mouth ulcers and genital ulcers, along with association like erythema nodosum, a systemic condition including inflammatory joint pain, and also uveitis. So this is a clinical approach for the episode. Apart from that, we have to do some investigation. Uh,
Yes. Like what?
yes, doing all general investigation, including the
Yes.
CBC, leukocytosis to rule out infection, inflammatory markers to check for ESR. It might be high during the disease activity. This is for the the specific test for Behçet Bethage test.
Yeah.
I will do Bethage
Yes.
test. It will be diagnostic. For the association and complication, I can do renal function tests. Also, for electrolyte, if the kidney is affected, it might be associated with amyloidosis. Urine dipstick as well.
Yes. So what about the complications that the patient had? What kind of investigation you will do
Yes,
in
some
the past history? Yes.
yes,
The patient.
it might have PE or
Yes.
thrombophlebitis.
Yeah.
So I
Yes.
can do DVT ultrasound Doppler to the lower limb to rule out DVT. Also for the PE, I can do CTPA.
Yes.
Or
It's
if
pulmonary.
it's chronic, I will do echo, measuring right side pressure, right side heart pressure, along with pulmonary artery pressure.
Okay. I'm gonna ask you a question. What is your potential diagnosis? If you put on the top of your list, Behçet disease complicated by anterior uveitis, what is the other differential diagnosis?
Yes, I can think about other cause of reactive arthritis, like of inflammatory arthritis, like reactive arthritis.
Yes.
Or also, I can think about psoriasis arthritis. However, no.
You asked about
So-
the waterwork of the patient. I remember
yes,
this. Okay.
yeah.
Yes, and you ask about the rash in the bottom of the sole of the
This is
foot.
for reactive. Yeah, this is for reactive
Yes.
arthritis.
Yes.
Also for psoriatic arthritis, but the patient deny any skin rash apart from
Yes.
erythema nodosum. This is my
Yes.
differential. Enteropathic also, if the patient is having change of his bowel habit or
Yes.
diarrhea, so I can think about enteropathic arthritis. This is my
Yes, because the
differential.
enteropathy it also increases the risk of blood clot, and it can even lead to eye manifestation,
Yes.
like Crohn's disease. There is another important differential diagnosis.
And inflammatory, you mean?
You said the inflammatory. It is
Yes.
soreness, especially with the soreness of the mouth and with the increased blood clot. There is an
Yeah.
important a differential diagnosis which had to be put in the list.
CCLE, you mean?
Yes, yes. SLE with antiphospholipid with
Yes. Mm.
antiphospholipid or anti-lupus. Okay, so I'm gonna ask you another question. What are the changes which can happen in the eyes in patients with systemic lupus?
And systemic lupus or
No, in
Behçet?
Behçet disease. Yeah.
Behçet is anterior uveitis,
Yes.
the most common presentation.
Yes.
I think I don't think scleritis and episcleritis, only anterior uveitis. Anything else?
Yes.
I'm not sure. Unless there
Because
is
it in
thrombosis.
yes, retinal veins thrombosis. It's right.
Yes, yeah, if
Um,
thrombosis, yes, you're right.
yes. And there is also ischemic optic neuropathy, which is an optic atrophy.
Yeah.
Both of them, it will be seen in the by the fundoscope, but the fundoscopy was normal, so it means that is an anterior uveitis.
Yes,
As you
yes.
said, there is also CNS complication which may happen to those patients.
Yes, neurodeficits. Patient might present with the seizure
Yes,
and neurological deficit. It might be also complicated by stroke.
dural sinus thrombosis. It is the most common dural sinus thrombosis and
Venous
septic
symptoms.
meningitis. Dural sinus thrombosis.
Yeah, and aseptic meningitis. Yes, you're right.
Yes. So thank you, Dr. Besson.
Yeah, thank you, Doctor.
You did very well. Thank you. I'm just going to ask you about the management.
Yes, sure.
So what are you going to give to your patient?
Yes, in the flare-up of the disease, I could give this patient steroid in high dose, and I
Yes.
will give him some education counseling about the complication of steroid, along with the
Yes.
gastroprotection, bone protection, and also for the long term. If he will be on long term steroid therapy, I should give him a steroid bracelet. Apart from this, after
Okay.
finishing the course of steroid, we might think about steroid sparing agent. But
Yes, immunosuppressive drugs, yes.
yeah, the cornerstone of the management is
there
steroid.
is a drug. There is another drug which is used for the ulcers and for the arthritis.
Yeah, I'm not sure about the name exactly. What you mean by
Colchicine. The colchicine.
okay, colchicine, yes.
Yes. Aren't you going to treat the anterior uveitis?
I refer the patient urgently to the ophthalmologist, and
Yes.
multidisciplinary team approach, including
Yes.
the ophthalmologist, rheumatologist, and specialized nurse, social worker,
Yes.
and the hematologist.
Yes. Don't you know what can they give for medication for the anterior uveitis?
Anterior uveitis?
Yeah.
No, I don't know.
It is a steroid eye drops, and if it's not controlled, it will be oral steroids, and if it doesn't help, it will be also immune suppressive medication.
Okay.
So thank you, Dr. Bassem, and
Thank
I
you,
hope that
Dr.
the case
Iman.
was good.
Yeah.
Thank
Thank you.
you.
Nice, very nice case. Thank you, Dr. Iman.
Thank you. Thank you.
Okay. Any comment, Dr. Iman? Now you can comment on the performance and the history and the examination, everything you can do. Go ahead.
The history was very well taken. Okay. You have just to cover the stuff of the differential diagnosis, like the covering the systemic lupus. Maybe I don't remember if you asked the question about the systemic lupus, all of them, most of them, because it's a very strong differential diagnosis. And the inflammatory bowel, the patient says the pain that the patient had, it was vasculitis. So it's the patient had colitis. The patient of Bassett had colitis. So
Yes.
it's sometimes a little bit confusing with the Crohn's disease, but the Crohn's, they had also, as you said, that they had change in the bowel motions, which can diagnose it. You also covered maybe you better mention the HLEB 51 and the
Yes, you're right.
HLA B27.
Yes.
Yes. Otherwise, I think that you had done very well.
Yeah, thank you, Dr. Iman. Thank you so much.
Not at all.
We
Thank you.
can, we can open now the discussion and the comments. Please feel free to comment. Yeah.
Dr. Bassam, did you ask fever, weight loss, appetite, lumps and bumps? Did you ask?
Yeah, I ask. She deny any of this, yes.
Maybe,
I ask about
maybe.
fever.
Uh,
Fever
regarding the
and
quality,
appetite and the weight. I ask while doing examination, actually, not in the system review. Yes. Go ahead.
regarding colchicine, I think we are using it for the prevention of the Besser disease. I think, not for the treatment. Treatment
I'm
for
not sure actually when and what to use for the, but I know the steroid as high dose for rest, flare up or reset activity. Yes, this is what I am sure.
steroid and steroid sparing agent, and for
Yes,
prevention we are
Yes.
using colchicine. Prevention,
for the
because
prevention.
this is a
Okay.
Yes.
different case.
So
Yeah.
you mean that they're given it as a maintenance therapy?
Yes, yes, yes.
Yes. Okay, that's okay.
They will give as a maintenance to prevent the
Yes.
recurrent relapse.
Yes. Okay.
Okay. Thank you, Dr. Azar. Any comment else? Dr. Ibrahim mentioned yes, HLA-B is 51. Yes, this is for BESIT. Is a specific test. SLE, yes, one of the differential. Colchicine, as mentioned by Dr. Azar. Apremilast. This is new medication for oral ulcer. So it's topical, you mean? Yeah, Dr. Ibrahim asked, uh, what? Yes, why not? You can ask, and if he told you the diagnosis, it's good. If not, never he will mention. Yes, what the problem? But I should know if he has past medical history. It's the same question. Are you diagnosed with any condition before? So when I ask here, did they give you diagnosis? Why not? Sometimes it will be wrong diagnosis. He will tell you that it was a diagnosis of SLE, for example. Either it will be a clue or it will be distract. I will not judge on it. Just I'm asking to get full history. This is the point. But it's okay. You ask. This is family. This is a station of history taking. You can ask whatever you want. No one will ask you why you didn't or why you asked. Okay. Tablet. I think. Yeah. Yeah. It's tablet. Yes. Okay. So apremilast. So what's the name or what the go? Is it biological therapy? First time to hear about this medicine. Okay, Apremilast.
Mila.
Oh yes, okay. It's a tablet for oral source. Okay, any question or any comment else, please?
Because when I saw this scenario, I was thinking that this is a case of reactive arthritis.
Yeah,
Uh,
the same as
you were
mentioned.
also thinking. That's why you asked that the rash at the
Yeah,
back of the foot. She denied.
yes,
And, when she
yes,
told this was erythema nodosum, then again, my mind also changed that it could be else something.
yes,
Then
you're
you,
right.
mashallah, you did very well, and you catch the diagnosis.
Thank you, Dr. Azhar. Thank you so much. Actually, the clue in Behsit always the genital ulcer. Whenever you have mouth and genital ulcer, equal Behsit. And you will find in the history PE or DVT, thrombophlebitis, anteriovitis, history of blood clots, either heart attack or PE, pulmonary embolism. So yeah, it's nice case, and I think they are bringing such case in the exam.
Yeah, yeah, it's a nice case
Yes.
because it was a trap. It was a trap
Yeah,
because everyone was thinking about the reactive arthritis.
yes, yes, of course.
Dr.
Yes.
Iman, very nice case you brought. Very nice case.
Yes. They say that the most common presentation is oral ulcer, and it's usually a recurrent ulcer, and it occurs at 3 times per year. It may even occur 3 times per year. It is the most common presentation. But I do not want to give him oral ulcer because I know that he will guess it
Yes,
very soon. So
yes,
I give
yes.
another presentation.
Nice,
Because
nice.
because because in the history, we usually not asking an oral ulcer and ulcers in the genitalia. We are not asking in the routine. So
Yes,
maybe if
exactly.
anyone will not ask, he can miss it.
Yes, you're
Yes.
right. But once you have some inflammatory arthritis, you have to ask. When you have suspicious of connective tissue disease, you have to ask. It's a clue for inflammation or something autoimmune ongoing.
I think we should make our routine that in case of any connective tissue disease, we can at least
Yes,
ask this oral ulcer and private ulcer,
yes, yes, you're
so that
right.
we
Yes,
cannot
you're right.
miss.
Yes, there
We
is a
cannot
doctor
miss.
who told us where once you had when you ask about systemic lupus, ask about his twins, which is antiphospholipid, and the other one, which is Bassett, because they have very common stuff in common between them.
Yes. Okay. Dr. Ibrahim add a comment for it used for psoriatic arthritis premilast. Joint aspiration should be considered. Of course, if I have time or the examiner ask more about investigation, you can go through most of the investigation, like even CTPA, echo. Here also the kidney affection, urine dipstick, renal function test, and HLA-B51, and also it might lead to joint aspiration after screening for coagulation profile. I mean, because patient was on blood thinning medication, so don't put yourself at risk to do this aspiration while patient coagulopathic. But it will be considered one of the steps of the management and the investigation. Yeah, I think it's supposed to be added to the investigation. Yes, you're right. Anyone else want to add comment or question?
I just would like to ask something.
Yes, sure.
The joint to ask the joint aspiration. I do it as a routine for diagnosis, or only when it is when I'm suggesting that there may be septic arthritis.
No, it's not always with septic. You can do it with inflammatory, right? You remember the leukocytic count in each.
Yes, but
So
it is done routinely. I do it routinely in any
yes,
in
yes,
any. Yeah, that's
yes.
okay. That's okay.
Unless there is suspicious of bleeding tendency, it's contraindication like hemoarthrosis. Don't proceed with
Yes,
it. Okay, let's go
yes.
to the diagnosis. If you do aspiration, how you diagnose the inflammatory and the septic? You remember the numbers of leukocytic count?
I guess it was 50,000, something like this, or I
The
don't remember.
50,000 with the septic
The
arthritis.
septic.
Yeah.
And the normal, it was less than 2,000?
The mechanical, less than 2,000. In between,
Yes,
this is for inflammatory. I mean, from
yes,
5 to 50,000.
yes,
But in case of mechanical like osteoarthritis, you will not have cells or less than 2,000. The septic one, it will be more than 50,000.
yes,
So you have to do it. And also you can look
yes,
at the crystals like in urate crystals
yes,
in gouty arthritis. And in pseudo gout also you can find the calcium.
yes.
Yes. And
But
also,
the idea that when you suggest from the very beginning that it is inflammatory type, I don't know, am I supposed to exclude the other type, which is mechanical, like pseudo gout, like
no.
osteoarthritis and stuff like that?
If you
Yes,
have inflammatory, go with the differential of inflammatory.
yes.
When you have mechanical, you will go with the causes of mechanical. So let's review what are the cause of inflammatory.
The causes, there is seronegative and seropositive.
Yes,
The
perfect.
seropositive,
Seropositive
like,
and seronegative. Yes, you're right. And the seropositive rheumatoid arthritis and association. The
yes,
seronegative, like in this scenario, basic reactive arthritis, ankylosing and psoriatic,
psoriatic,
right?
yes, yes.
Okay. What about the mechanical ones?
It may be trauma, it may be hemarthrosis, it may
Yes.
be hemochromatosis, it may be pseudo gout, it may be
Pseudo
gout.
gouts. Yes. Gout and one more, osteoarthritis.
Yes, or sussex.
So the question, when I ask you the movement worse or improve, it will give me a clue what is the nature of this. The movement will worse the mechanical, and the movement
Yes,
will improve the inflammatory, right?
yes,
So you have to ask this question to know what you are talking about.
yes.
Okay, Dr. Azhar, you said something. Sorry, I interrupted you.
Gout is inflammatory or mechanical?
Pseudo
Actually,
gout.
no, the gout itself.
Okay.
Sometimes, if there is tophi, it will be mechanical. Okay, it works with the movement. But other joint, you can consider as inflammatory.
Because it is doubtful. I
Yeah,
have read.
always doubtful. It's always doubtful. But I can consider in both. But when you have tophi, it will be mechanical because of the pain. It will limited your movement.
No, otherwise, it is inflammatory.
I
Yeah,
think
otherwise it's
mechanical.
sorry.
I think mechanical gout.
It's mechanical, but if the tophi is associated, this is my thinking. I don't know.
Then why gouty pain is more in the morning? It increases with rest and decreases with the movement.
That's
If it
why
is
I
mechanical.
can put under both categories.
I think
The
with
gouty, yeah.
I think in the next meeting we should search about this. We should look because some they are saying it is mechanical, but when
Yes,
we are reading the books,
for me,
it's
I put it mechanical only with Tufai,
Hmm.
if Tufai is associated. But apart from that, I put it as inflammatory. I mention always with the inflammatory, but if Tufai is present, it will lead to mechanical pain in big two.
Dr. Basim, you mean
Yes, Doctor.
you mean
Yeah.
to fly in the involved joint ولا
Yes,
ولا
if
anywhere?
in big two, mostly the Tufai in the big two, right? Metatarsal, the first metatarsal.
Okay.
It may be in the hand, it may be in the ears.
Yeah,
Yeah,
it can be anywhere, صح.
anywhere, yeah, but the most common is the first metatarsal. Always
First
they bring
metatarsal.
it in the first metatarsal, but yes, it might happen even in the costochondritis, in the cartilage also of the ears. Yes, you're right. In the hands, yes, but the most common is the first metatarsal.
What is the relation of seafood with the gout?
Uric acid production.
Seafood increases
Yes,
fish.
increases.
So what should be the actual diet for the gout? You cannot
No,
take fish,
sorry, the red meat increases. The red meat, but the white is not.
but I have heard from many people that the seafood, they are also increasing it.
Seafood, I think phosphorus, not
I think
uric.
purine. I think it's
Purine.
high in purine. صح ولا؟
I'm not sure.
I think so.
Before I was thinking that fish is safe in gout, but most of the people say no, fish is not safe in the gout.
What I know, the white meat, like
White meat is safe.
safe,
White
like
meat,
yeah.
you
But
cannot take red meat, you cannot take fish, you cannot take
yes,
cereal, and then only vegetables, bus and chicken only.
sorry.
So you cannot take red meat, you
Yeah, you
cannot
cannot
take
take red
fish,
meat. Yes,
you cannot take
alcohol,
cereal, beans.
the alcohol
You
also.
cannot alcohol. You cannot take. Okay, alcohol is not in our religious.
Yes.
Uh,
I mean, in the exam purpose,
for
alcohol
for
exaggerate.
example,
Yes, the meat,
so
seeds also. The seeds can worsen it.
seeds
Yes,
and beans, they are also rich in. And then kidney, liver, and brain, they are also rich in high purine diet. Patient can also cannot take
yes,
these.
yes,
Only
yes.
vegetables and chicken is left, bus
Yeah,
for that.
you're right. Okay. Protein diet, yes. High protein diet is risk for gouty exaggeration. Dr. Ahmed share gout is mechanical. Okay. Pseudo gout as well, mechanical. Septic arthritis, mechanical. Yes, you're right. Uh, restriction of protein source in general, Dr. Hatem. Yes. Any protein containing it will be advisable. For monoarthritis, for acute single joint aspiration, consider when acute. Yeah, it's highly recommended to do aspiration whenever you suspect septic arthritis, or you must do it. Okay, this is for aspiration. If polyarthritis, yeah, it's not recommended. And the same for steroid intra-articular injection. You can do it in monoarthritis, but if you have polyarthritis, it's not recommended to do. So the same idea, not to aspirate more and not to inject more. Okay. Thank you for the comments. Any comment else? Thank you, Dr. Azar, for the comments today.
And thank you, Dr. Basim, for giving me a chance
Yeah.
to participate.
Most welcome, Dr. Iman. Most welcome. You
Thank
did
you.
great, really.
Thank you.
Carry on.
Okay. Thank you.
Thank
And
you,
thank you
Dr.
for all the doctors who given any kind of
Yes.
comment. Thank you.
Most welcome, Dr. Iman. Most welcome.
Thank you.
Any question from others, please? Dr. Ryan, also thank you for your comments today and for attendance. I don't know why you are on and off.
Thank
Like,
you, Dr. Bassem. I am a little busy. I'm
yeah.
coming back soon.
Okay.
Thank you, Dr. Bassem.
You are most welcome anytime, Doctor. You are on and off like Levodopa. On and off phenomenon.
I put the name in the group, Apri Milas, very difficult to remember,
Yeah.
memorize. I
Yes.
put it in the group.
I challenge any examiner will know this medication. They are not well knowledgeable doctors. The
Yes,
examiner.
yes,
They have some knowledge about the case and that's it.
bas.
Yeah, maybe they will read about the topic in the morning before the exam just to refresh themselves. But we have to be ready. Okay. Thank you, Hatem, Dr. Ahmed Mahanna. I hope I didn't miss any of the names. It's nice session. Well done, Dr. Iman. Inshallah, hopefully you will join with us with the other practice in another session. Thanks all. We can end the session now if no more questions. Yeah, thank you, Dr. Iman. Thank you, Dr. Azhar, as well.
Thank
Always, your presence is precious for us. Dr. Ibrahim as well. Thank you. Thank you, all of you. I hope I didn't miss any of the names. See you tomorrow, inshallah, with the communication day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.